I spoke earlier with Dr. Doug Harrington in Los Angeles. He's a preventative medicine specialist. He talked about the pros and cons of online diagnosis and how the public can protect themselves.
There's lots of information there that's useful for patients. The bad news is that there's a reason why healthcare professionals go to school so long, and that's because they need to sort through all of the myriad of symptoms that one can get, and simply reading about it online can cause people to think they have multiple diseases. And so it's really critical to not overdiagnose yourself or to rely too heavily on it. And you also have to consider the source of the information. Some of it is put on there by individuals who really have no healthcare background and may be trying to sell supplements or weight loss products.
How should consumers know whether these websites are vetted and whether they're reliable?
Well, the easiest thing is to go to names that you recognize. Like I mentioned, Mayo Clinic and the National Institute of Health. They actually have review boards that review what goes on their websites, and their information is carefully designed to provide patients with layman's terms of what they're looking at, what they might be experiencing, and when to contact a doctor. And they often provide resources where you can actually call somebody up. And again, I would urge caution that it's very difficult to diagnose yourself, and there are certain symptoms such as chest pain or abdominal pain where you do not want to second guess yourself. You should be seen.
And by vetting, do you mean this is also the way they're regulated or perhaps monitored, even the reputable organizations you're mentioning?
Yeah, they're monitored. When I say it's not really regulated, it's a professional board that looks at the information that's placed on the website, and they agree that it is scientifically sound and that it's useful information for patients, because individuals can find a lot of opinion on the web, and much of it is based on hearsay or wives' tales, they call it, or misinformation, particularly weight loss products, things like that. I think the one thing that's always true is if it sounds too good to be true, it probably is too good to be true. So don't fall for those, but stick to reputable sites.
And Dr. Harrington, medicine seems so integrated in technology now, and at the end of the day, is this a good thing for us, the patients?
Well, I think that it's a really good thing. In particular, I think the smartphones and smartwatches are going to give us more real-time feedback on the status of our health. And I also think that informed patients are much easier to take care of because they ask very intelligent questions. They tend to want to grasp the type of disease in particular, I focus on prevention. And I think informed patients are more willing to listen to the things that you want them to do, like to keep their weight at a particular level and to exercise.